G'day, how you going?
Alright, okay, so Ben, when I saw you last week, it was the first time in quite some time, wasn't it?
It was, yeah.
It was the first time in almost a year, I think. Anyway, you've had some issues with your hips and your pelvis.
Yep.
Just you feel like they're twisted and out of alignment.
Yep.
And we adjusted you last week because you were getting some pain in the right hip, and you'd noticed it when you were walking. You said that you described some walking issues. How was it after last week?
After last week, the pain and the issues with walking had gone, and I was able to walk freely, jog, run, do whatever I need to do. I noticed a little bit of pain come back, although it was slightly different, I think, from over-sitting. And I don't know if it was the wrong position or just over-sitting. And
this is in the right hip?
Yeah.
Some pain came back?
Yeah. But after that, it sort of dissipated after I stretched a bit. Noticed it a little bit today, that it feels a little bit off, but not substantially.
And where was the pain? Just for the sake of having
Across the hip flexor.
So on the lateral and the sort of posterior aspect.
Yep.
Okay. What did you get up to on the weekend? Were you active at all? It was pretty hot.
I was active-ish.
Okay, as active as you can be in 40-degree heat.
Yeah.
Did it exacerbate the way you felt at all?
No, I was feeling generally pretty flat, so that didn't help.
Okay. All right. Well, let's take a look. Are you okay to whip your shirt off?
Yeah.
Okay. Well, whip it off and then come and face the mirror. Okay. So just march up and down on the spot for me there. And when you're ready, just stop there. Okay, just bend forward as far as you can for me. Try to touch toes. Does that bring on any pain in the hip? Okay, come back up. I can't remember if I said this to you last week, but it looks like the left side is more the problem area when I get you to do that. Just raise your right knee towards your chest, please. And down. Do your left. And down. Okay, do your left again. And down. Do your right. Okay. I'm just checking the movement of your sacroiliac joints there. Just give yourself a hug. Just going to support you here. Just tell me if this hurts at all. You're okay with that? We go the other way. You're okay with that? Okay, good stretch.
Yeah.
All right, just lie on your back for me. Get your head up this end. Okay, we'll check your left hip first. All right, I'm just going to bend this right up. You're okay there? Okay, cross this leg over that one. You okay with that? Okay, just relax that there for me. That's pretty good. You're okay with that? Head sore, was it?
Yeah.
Where was that? This.
Right in the joint.
Okay, it felt like a bit of a pinch, did it?
Possibly. Could have been more like just pushing it out of the.
Okay, you alright with this?
Yeah.
Is that okay? Okay, let's test the other one. Okay, this is the supposed dodgy one. Okay, bending right up. Any pain or discomfort here? That one, just bend this one as well. Keep both of them there. I'm just going to push both of them up towards you. Okay, floppy legs. Give me all the weight there. Yeah, so this one comes up higher in deflection than this one, doesn't it? This one just feels a little bit blocked.
Yep.
Would you agree with that?
Yep.
Okay, good. Straighten this one, keep this one down. Okay, let's drop this out to the side there. How does this one feel compared to that left one? Is it a bit more ginger, is it?
Yeah, it does.
What about this side?
Yeah, it just generally feels tighter in the hip joint.
If I push down like this,
Not as bad.
you okay with this?
Yeah, no problem. Ooh.
Little knee pop.
Yeah.
Okay. Let's just try something here. This might be a little tender. Okay, I was just rubbing across the right sacroiliac joint there just to try and excitate the sacral plexus, a whole bunch of nerves that are around your pelvis. Now I'm just rubbing along the greater trochanter for the same reasons, just to sort of stimulate all the nerves around there. Was that a bit sensitive?
It was.
Okay, just hold the sides of the bench there for me. We're going to adjust this right hip. I'm going to tug down on it. I think I did this with you last week. Just keep this leg nice and floppy. I'm going to do little circles.
Yep.
And then yank down like that, okay? So nice
Yep.
and floppy, you okay here?
Yep.
One more. Nice and floppy there, Ben.
Mm-hmm.
There you go. Okay, bending both knees. Sometimes we'll feel a bit more of a clunk
Yep.
on that one. I didn't feel a great deal then. Just keep this floppy for me. Okay, you got to tell me whether you notice a difference here.
A little bit.
I still feel like this one goes up higher.
It does. It feels like this
Yeah.
gets caught in here.
This is a little blocked.
Yeah.
Just turn over face down. Let's have a look at your pelvis different. This is pretty subtle here, but his pelvis seems ever so slightly tipped over this way. It's very difficult to pick this up on camera, but when I look at the view from here, if you want to come around and try and get down at my sort of level with the camera, I just feel like his pelvis is tipping over a little bit. So if you stay there and we just block him with the pelvic blocks here. Yeah, I definitely think that's more level. How does that feel to you?
Yeah, it feels like the right's released a little bit.
Yeah. So it feels like, despite these blocks being positioned underneath you in an uneven way, that you're in a more aligned position.
Yeah.
Would you say?
Yeah.
Yeah. How do you feel on this right side of your lower back? Does it feel stiff or
Yeah, a little bit.
not overly?
No. Maybe I'm just used to it though.
It feels stiffer up this part to me than down there. Like actually,
Yeah.
I kind of sink into there kind of nicely. Just here,
Yeah, there's a bit of pain in there.
yeah. You alright with this?
Yep.
Okay, so this left side. Yeah, left side too seems alright. Like down in through that lower back there, I don't feel like this is too bad really.
Yeah.
Bit stiff in through there. I'll just adjust you in through here.
Yep.
Give me 1 sec. I just want to try to find a spot here. Okay. Yeah. So don't lie to me here, but is this sensitive or sore?
It is.
Yeah.
Yeah.
So I'm not pushing down with very much pressure here at all. Like if I really wanted to push in, you'd be like, please don't do that.
Yeah.
Maybe this one too, Ben?
Yeah.
Okay. So a lot of people ask me, what's going on there? Like, how do you know that this is sore, right? So the spinous processes are these knobbly bits you feel on the back of people's backs. And they stick out pretty proud. As I run my hand down, when I get to, where was it? This point here, which is about level with the bottom of his shoulder blade, which means it's around about T7. Could be T8, whatever it is, T7, T8. It feels as if it's the spinous process of T7 is slightly more buried. So my interpretation is that when he is upright, either sitting or standing, the way he organizes his posture is such that the majority or a large amount of compression is accumulating at T7. So if you picture stacking some building blocks on top of each other, like the wooden ones you used to play with when you were a kid, you might try to get them straight, but some of them will be off center a little bit. Those ones that are off center, because you're not using the full area of support, some of the compression will be focused on only a section of that available area, and therefore it'll become overly compressed in one part of the segment and painful. And the specific nerve that is registering that discomfort is the sinovertebral nerve, which is the one that innervates the skin just above the spinous process. So that's how I do it, Ben. Which I'm sure you'll go and verify on Google now. But yeah, when I push on here, it's sensitive. And basically, in layman's terms, I think this vertebra has been buried between the ones around it, and we're going to try and create some more movement. So I'll try and do an adjustment where I just want to do it prone today. Usually I'll do a wing lift where I'll sort of nicely gap the joints, but I just want to give Ben's body a slightly different approach. So just breathe in for me and breathe out. Nice and floppy there. There we go. Good. Okay, that was pretty good, huh?
Yep.
So my line of drive was more up that way, so I am still getting some space rather than just coming straight down and burying it even further. Okay. How's that, Ben?
Yep.
Do they feel okay?
A little bit of tightness through the knee there.
The right one? This
right,
one?
The right one.
The right one,
Yeah.
okay. The one that we cracked.
Yep.
You okay? It's not,
Yep.
it's
Yeah,
not
no, it's
comfortable?
fine. Yep.
I feel like they're pretty good. Have you forgotten about those blocks?
Yeah, pretty much.
Yeah. Okay.
It's annoying when you take them away.
I'm just gonna pull this towel off. I want to see if we can see any difference here. Yeah, I mean, I definitely think there is. Whether it comes up on camera or not, we'll know. But yeah, whereas before it was tilted over this way, I just feel like he's more supported through here now. Okay, so we'll put the towel back on you. We've got a nice amount of movement through the sacroiliac joints here. Let's lie you on your left side. Okay, you might want to get me from over there.
Pretty
Save some for me, man. I think I might just get you to move back on the bench a little. Yeah, that's it. That's good. Okay, I'm just going to position your arms like this. You okay with me?
Yeah.
Breathe in, breathe out. Right hip okay?
Mm-hmm.
Oh, we got a clunk out of you there.
Yep.
Okay, I am going to get you going to the other side as well here. I want to do one slightly higher up in your back. Oh, there's one already. Okay, breathe in for me. Breathe out. Okay, I'm going to try that again. That's quite stubborn. Breathe in, breathe out. Got it. Well done. Okay, slide it back. I just changed my contact there. I was using a long lever before. That's where I sort of have my contact points at a distance from the segment that I'm going for, whereas the second one I actually put my hand right over where I needed it to be. And it did adjust, but it wasn't a beautiful loud sound, which may have come across, but yeah, definitely something happened, right?
Yeah.
Okay. Let's try and mobilise this hip a little more, because we really need to get it up, flexing more here. So just keep this hip really floppy for me. Just try and give me all the weight there. I'm just applying a bit of pressure through the inside of the knee here, just to really explore external rotation of the hip and flexion up and through there.
Definitely a bit of
Grinding.
yeah.
Yeah. It's a little disconcerting having this done to you because you feel very vulnerable. Like if I was to go back like that, you know, we wouldn't be friends anymore. This as well with people's hips, you've got to be careful coming into too much internal rotation of the femur because it gets quite pinchy, doesn't it? This is nearing what we call the closed pack, the close packed position of the hip where there's not much room for it to move. When we stuff it or pack it into a very compressed position. But I try and think of this as me sort of grinding a bit more shape in the acetabulum of the hip, which is the socket part. The hip is a ball and socket joint, and we just want to, in a sense, remodel the joint surfaces as best we can, because the tissues are like clay. We can mold them a little bit. Did we get a little pop then in the hip? So those pops often denote movement. And probably what's good for you as well, then, if we were to do some traction through your hip, because bring it up into that flexion. Range of motion is where you're sort of most hindered. So, imagine yourself hanging off the edge of a step with a weight attached to your ankle, just pulling this leg down. So I'm going to sort of support you here with your within your left leg, and just sort of like pull like this. Can you feel much traction through your hip?
A little bit, yeah.
I'm pulling with as much force as I can. Sometimes we might if you just keep this leg floppy and I just sort of tug, do you get more traction through this in your hip, or?
Doesn't feel that much different.
No. Okay. Let's test it now. Just bending both your knees for me. Flop your legs here, give me all the weight there. How does that feel?
It's a little bit tight around the back.
You feel in your back now?
Yeah, lower back.
Did you feel any of that pinching in through there?
Not as much, no.
Okay, well that's what we're going for. So with tightness in the back, what I would then suggest you do, and you can try this now, bend both your knees, bring them perpendicular to the floor, cross your ankles, keep your knees wide and hold your knees around the outside, and just repetitively rock your knees towards your chest. And when you do this, you want to try and explore the tightness in your lower back reducing. This should feel pretty nice, like last night. I've showed you this a million times, I know. But then also as well, like, try to explore the range of motion you're feeling in your hip, like see if you feel this pinching sensation reducing.
Yeah, it's not there at the moment.
Yeah, which is good. And then you might progress from that, keep this knee up, but you can drop that one, keep it bent, and then just hold here. And you can pull your knee outwards, you can pull it inwards and sort of twist in and pull it straight up. And that way you're exploring that range of motion with yourself as well. You just sort of maneuver it around. Like think of your hip as a ball and socket joint, which has temporarily changed its morphology, and doing this sort of stuff is just grooving yourself a new hip joint. Okay, and you just have to spend time doing this. Now that we've adjusted you by decompressing the joint and your back, in my mind you're moving as well as you can. It's up to you now to propagate that result. So you can keep your legs long. I'll just finish adjusting the rest of you. I want to get behind this side. Breathe in for me. Breathe out. You okay there? Good. I'm going to do the other side too here. That's it. Yeah, thanks. Just like that. You almost got it, man. 80%. Breathe in, breathe out. You okay there? No, that was a bit stubborn, wasn't it? Okay, you can relax those arms. How's your neck been?
Fine, no issues with it.
Do you want me to take a look?
Sure.
Yeah. You might be just a fraction high here. Just slow down just a tiny bit. Good. Thanks. With my fingers, I just push the neck in different directions, left and right. I push up along the back. This is some very crude motion palpation, just giving me an impression of how the neck moves, and generally it's pretty good, isn't it? I just keep on coming back to this point here. So I just feel a mass of tissue that feels a bit clumpy and lumpy, and it's, I think, restricting the movement a little bit. So I would like to adjust you there if you're okay. Just on this one side. You okay there?
Yep.
Oh, that was pretty good, wasn't it? Okay, one more for you, alright? I'll get you sitting facing to your right. You might want to get me from right where I'm sitting. It's probably the best for you, I think. Okay. I always put a towel across my chest like this. People ask me why. It's because I don't want to share Ben's underarms with my next patient. Even though I know you're a very hygienic person, Ben, but I'm sure you wouldn't want to say. Okay, hands on top of your head. That's it. Okay, put your hands on top of mine, elbows together. Breathe in, breathe out. It's nice and floppy there. Can you look up for me? There we go. Nice. Alright, so hop up and come and stand facing the mirror. Okay, just march your knees to your chest a couple of times each. And you can relax there. Okay, bending forward as far as you can. Okay, and back up. I just want to test this a little bit. Raising the left knee towards your chest and down, and do the right and down. Yeah, so when you bent forward, I felt like your movement was dragging my left thumb more superiorly, which indicates to me that the left side of your lower back wasn't moving as well, which is why I got you on both sides. Just turn your head to the right and to the left. There you go, you're a picture of health again, Ben.
Thank you.
Thanks for donating your body to science. Thanks for watching. Please subscribe to my YouTube channel. Yeah, thanks mate, good on you.